Good afternoon, everybody. This is Tara, and we are coming to you live from the core at La Encantada. For those of you that are joining us, you are in the right place for back and core strengthening guides for adults over 50 with our speaker today, Kathryn Berry. A few quick things to help you get the most out of your at-home experience. What you can't see behind me is actually a live audience in the crowd. I'm personally quite excited because while we're still following our social distancing and masking protocols, it's the biggest group we've had this year. So starting to feel a little bit more normal as we move towards the fall and revamp our programming. For today's lecture, a couple of things for you at home. If you have any questions and you're watching on YouTube or Facebook, type those in. I've got my teammate Kate keeping track of those comments, and we will make sure to relay those comments to the presenters before the end of the talk. There will also be some demonstrations today, so if for any reason you cannot see one of those, type us a note. We'll do our best to try to get that demonstration into the camera view for you. So without further ado, I'm going to go ahead and get us started and hand things over to Kathryn. Thank you very much.
All right. Hello. I'm thrilled to see all of your lovely faces. My name is Kathryn. I'm a physical therapy student at NAU. We're going to be talking about back and core strengthening today. I'm going to click it over to the next slide. I'll just click it here. Okay, so this is just a little bit about me. I am getting my doctorate of physical therapy at NAU. I'm in my last clinical rotation right now at the Tucson Orthopedic Institute. I got my undergraduate degree in neuroscience at U of A, and I am thrilled to be here with you all. And also, this is Sam Neidig. She is a doctor of physical therapy. She's my clinical instructor. She'll be helping field any questions today and helping with the demonstrations as well. So today we're going to start by going over a little bit of anatomy, kind of the muscles involved in what we're going to be doing. We're also going to talk briefly about some of the benefits, why bother strengthening the core and the back. And we'll go over foundational movements. That's kind of what I'm going to call them, since they're movements that, when done correctly, carry over into everything we do in day-to-day life. We'll also get into our exercises with demonstrations. That'll be kind of the meat and potatoes of our presentation today. And then we'll go over kind of stretching, posture, and a couple of do's and don'ts. And just a general disclaimer before we get started. This is a general guide. Back and core strengthening can be modified in so many different ways, and particularly if you do have low back pain, that can present in a lot of complex ways. So if you do have specific concerns, please feel free to call and schedule an appointment with a physical therapist. They're going to be all too happy to help you with your specific needs. So jumping into our anatomy review, what is the core? Other than, where we're at right now. So the core is kind of like a bowl, with the diaphragm being the top, your pelvic floor being the bottom, and then all of your muscles in your stomach and your back are going to be the contents of that bowl. And so we have some specific ones, transverse abdominis running up and down. We have our obliques running in a diagonal fashion. Multifidus is a group of muscles in your spine, as well as erector spinae. So, our diaphragm is actually quite important for core. Breathing is fundamental to everything that we do. And the diaphragm is kind of this parachute-shaped muscle that's right under our lungs and right there at the base of our rib cage. And our pelvic floor muscles, that could be an entire talk on its own. The muscles there are very complex. They work in a lot of ways to support sort of the bottom aspect of that bowl of our core. So this is just kind of a visualization, but we won't get too much into the nitty-gritty there because pelvic floor physical therapy is an entire specialty on its own. And then here is just a little diagram to show you some of the layers of the muscles of the abdomen. And here we have some of those back muscles that we were talking about. Our multifidus is in that darker red, running up and down the spine, kind of attaching at your vertebra at every level. And then your erector spinae are a group that are on the other side. We have spinalis thoracus, longissimus, and lumborum. So that's kind of getting all the different levels. And then this is also something that can be involved in the core when our muscles aren't working the way that they should be. So that's called diastasis recti, and that's what happens when there's a little bit of space between the muscles. So they're not joined up perfectly together, they've been somehow separated. And that happens very commonly in pregnancy when we have a lot of space that's kind of pushing and creating separation of the muscles. Other things like weightlifting very heavy objects over a long period of time, that increase in abdominal pressure can also lead to a separation of those muscles. And again, that can look very different for each person, depending on where the separation is. So if you have anything like that, or hernias or things like that, that can play into how we work on our core strengthening. And so why strengthen our core? There's a lot of research that suggests that it can decrease low back pain. And why that may not work for everyone to decrease their low back pain, it does help in a lot of cases. Also, having a good solid core and back musculature helps a great deal with maintaining a nice upright posture, a nice neutral posture. And if we can hold that and maintain that through all of our daily activities, that's going to lay a foundation for everything else to build on as well. It can also decrease your likelihood that you will get a back injury, which is probably the most common cause of low back pain to begin with. And so just a word of advice here when it comes to the core strengthening. Again, everybody is unique. Low back pain presents uniquely in a lot of different cases. So what works for one person may not work for you, and that's okay. And that's another reason to work, one-on-one with a physical therapist, because they can come up with all different sorts of modifications and really tease out what your unique problem is. So we'll go ahead and start talking about our foundational movements. The first one is going to be our scapular mechanics. So the scapula is this bone, your shoulder blade behind your shoulder. And there's a couple of different ways that it can move. The way that this diagram is showing right now, it's called protraction, when your shoulders are rounded forwards as such, and then retraction, when the scapula are coming together in the back. And so this is really important for keeping a good posture, keeping the neck and head aligned nicely. And then Sam, if you wouldn't mind also just stepping in and showing them a little bit. And she'll be kind of exaggerating the movements. So we'll start with protraction, bringing the shoulders forward, rounded, and then as we come back into retraction, really bringing the shoulder blades back down and together. And you guys can try that here on your own if you'd like. Another view like that. A way that I like to think of it for the scapula, if your scapula are here, tucking them down into the opposite pocket is kind of that retraction, kind of holding it there, strengthening those muscles that bring us down and back. It can be pretty important. A lot of us, sometimes myself included, I get stuck more in this posture. So if we get more tight here, we get more weak with this type of movement. So that's a great one to remember throughout the day. And then diaphragmatic breathing is one of my favorite things to teach. If you can't breathe well, you can't do a lot of other things with good form either. So that is something I like to talk about a lot. With diaphragmatic breathing, obviously we're going to be engaging that diaphragm. There's a couple of different ways that people might tend to breathe. So some of us breathe more from our upper chest and our shoulders and our neck. These are more accessory muscles of breathing. And if you notice ever that you carry a lot of tension in your shoulders, that can be part of it. Because if we're all day, every day, kind of breathing from here, that's going to increase some tension. And so with diaphragmatic breathing, We like to bring it down into the deep low belly. And so with our inhale, I put my hands kind of on my low belly so I can really feel when my inhale comes down, my hands move away. And then with the exhale, my core contracts and the exhale goes out. And so Sam can demonstrate that as, again,
On the ground for this one?
yeah, either one. It's a little more intuitive to learn actually while you're laying flat because the belly naturally kind of comes up with the inhale and then comes down with the exhale. And so it's probably kind of hard to tell here, but again, we have our diagram. And on the other side where we have the musculature, we can see how engaging the diaphragm can change how we have pressure in the core and in the abdomen. And again, this is something that you can do all throughout the day, taking a nice mindful moment to think about the breathing and really feeling your abdominals working with that breath can increase a little sense of wellness and calmness as well. Yes?
Do you follow that step with filling in the lung first and then the abdomen, or can you do it at the same time?
I feel like you can do that at the same time, kind of bringing it into your lungs and allowing that to then expand into the abdomen. Mm-hmm.
I feel like I can do both at the same time, and then there's more space in the abdomen.
Yes. Mm-hmm. The main thing you just don't want to have is where it just kind of stays in the chest, where it's only pushing your chest up. We just need to make sure that at some point it's coming down and opening down into the low belly.
But then exhalation comes through the abdomen.
Mm-hmm. Yes. So you'll have some contraction there and then exhaling out.
So from the abdomen down to the lung.
Well, so I have to do it myself too. So yeah, it really comes from your lower belly. Mm-hmm. Yeah, of course.
Yeah, add to that, your movement's coming from the lungs still, and the diaphragm is active. It's descending as you breathe in, so the lungs are expanding more down and out into the chest when you're breathing using the diaphragm.
Are there any more questions on that one? Okay. And then our next foundational movement has to do with your pelvis. And so for some of us, we might notice, Sam, if you could step forward, kind of showing some of the different ways we might hold our pelvis while we're standing. Might not always be in the neutral position we'd like it to be in. And actually, I guess I can show here as well. When there's an imbalance of muscles, we might have our pelvis tilted more back and out. So that would be more of a lordotic pose. And so I'm sure Sam is accentuating that for you. Most of us probably aren't that bad, but and then coming the other way, almost like a scared dog with your tail tucked. That can be a different position for our pelvis to be in. And so we don't really want to be in either of those positions all the time. We want a nice neutral position. But to get a sense of where those spaces are and how to control those muscles, turn them on and have them engage and coordinate for us, we can practice something called pelvic clocks. And so you might imagine that there's a clock sitting on your pelvis with 12 being at the top and 6 o'clock being at the bottom. And so as this diagram shows, and as Sam will demonstrate for you, when we're rotating our pelvis up towards 12 o'clock, we have a little bit more flatness, more congruency of our pelvis with the mat. And then you can come back to a neutral position and then back the other way where our pelvis is rotating down towards 6 o'clock. And you can see where in the diagram, and hopefully you can tell with Sam as well, there's a bit of space there between the low back and the mat. And so we can sort of move between these positions as a great way to start coordinating and having that connection between our mind and the muscles in our pelvis. And there's plenty of ways you can coordinate that further, going clockwise, counterclockwise, and that can get kind of tricky, but this is a great foundation to work off of. And then, so going back to this pelvic posture idea, this is something that if you notice you're tending to be in more one position than the other while you're standing, just in a relaxed, neutral way for you. If there's something kind of off, you might want to consider talking to a physical therapist, and they can assess sort of what muscles might be weak or tight or anything else, because the way that we stand with our spine and our pelvis can also contribute a lot to potential low back pain or any other issues that we might have. Pelvis is really a keystone in a lot of our movements. And so then we'll get, yes?
I'm sorry, is it better then for us to have our pelvis tucked in rather than pushed out?
So we want it neutral. We don't want really extreme one way or the other. But if you're noticing you tend to be out like this in that lordotic posture, tucking the tail, so to say, can hopefully alleviate some pain and strengthen the muscles back up to hold you more in a neutral position. Okay. And then we'll start with our first exercise. All right, so for this one, hopefully everyone at home can see this. We have a exercise ball or physio ball, whatever you'd like to call it. And so I have Sam sort of kneeling on this Airex mat is what it's called. It's just kind of a cushy mat so you're not hurting your knees. You could use a pillow, a folded up towel, anything that's just kind of keeping your knees from being uncomfortable. And we'd like the knees to be about shoulder width apart, hands resting nicely on the physio ball, keeping that neutral spine, neutral shoulders, neutral pelvis, like we all talked about. And then rolling the ball out, kind of leaning in, using the core to engage for us. And then just a little tip that I like to think of with the core, one way to know that you're engaging those muscles, think of it the same way as if you were to have a little cough, like you would feel those muscles kind of engage and turn on or push into your hands. So that's one way you can test to sort of see that they're engaging the way that they should be for this exercise. And so you can move forward and back. If you feel comfortable with that, you can also try to go side to side. And then that's going to get a little bit more of those oblique muscles. You can also do clockwise and counterclockwise. So really, as you get more comfortable with the movement, always try to advance it a little bit. If we're doing something that feels easy, then push it. I would never ask anyone to do something that was easy, or at least not too easy. Okay, and then for our next exercise, our classic bird dog. And so Sam will demonstrate that as well. This is a fantastic exercise to target not only your core muscles, your back muscles, also your glutes, a little bit of upper extremity as well, because we're having a little weight bearing into our hands with this one. And you're going to want to maintain a nice flat tabletop position. When you feel stable in that position, go ahead and lift one arm and the opposite leg. And that in and of itself can be quite challenging to maintain the proper neutral positions that we've talked about. If you feel like you want to make it even harder, you can, at the top of one of those movements, you can add a little pulse with your arm, your leg. That's going to make it a little harder. You can also add an ankle weight strapped to the ankle or the wrist, just to make that a little more resistance to compete against. You can also add TheraBand, which is just sort of an elastic band. They come in all different grades. Yellow is the lightest one, red, green, blue. They can get harder and harder as you go. You can attach that to one hand and then have it resist bringing your arm out, or to one knee and have it resist bringing the leg out, or both, depending on how challenging you want to make it. But those are some ideas to advance it if you feel like you've got that solid. And really what I tell everyone is it's more about doing it a couple times with great form, feeling those muscles engage, going slow through a controlled movement, than rushing through with poor form, not really getting that core engagement, that's going to be, you're not going to get as much out of that. Okay, and then glute bridges are a personal favorite of mine. They are also great for core and back as well as glutes. And glutes are important for how we walk, how we stand, everything that helps us enjoy our lives. So with this, you're kind of having the knees at a nice 90 degree, maybe a little bit less. And you'll push down through your heels as you're engaging your core and your glutes to push the hips up to that nice flat. In the diagram, it's a little bit overextended, but Sam is doing an excellent job of keeping that nice, excellent angle for you to see. This can also be modified in a lot of ways as well. So you could do this with the ball. I wanted to show you that a ball has a lot of great uses, so it's not like you would just get it for one exercise. There's a lot of different things you can do with it. If you don't have a ball, so yes, you can put your legs over the ball and lift the hips up. And then if you want even more challenge, you can have more your heels on the ball. That's going to be engaging the core and the hips even more. And it's going to be a balance challenge. So balance and coordination is another really important thing that we always want to be adding in wherever we can. Because balance is important for not falling. And if we fall and then we have an injury, that's even more likelihood that we're going to have low back pain or issues there. So preventative is always the best way to deal with the problem.
Is there a reason why in the picture the hands are in that position, the arms?
Okay, so that is kind of more of a yoga position, so opening up the chest even a little bit.
Yeah, I am a yoga instructor as well as a physical therapist. I do not prefer for people to do it like that because when you extend your chest that far open, you're really crunching in the neck a little bit. So we want to go up as high as you can without sacrificing the neck.
Very good. All right. And then with that, again, you can modify it to make it harder too by doing, one leg extended or adding a pulse of that leg at the top, holding it. And really contracting the glutes and holding that position at the top is good too. Making sure you're getting the most out of that movement. And so when it comes to how often to do these things, how many should we do, that is really about how you feel when you're doing it. If you do 3 and you do them quality and you're exhausted, that was enough for you. Don't feel like you need to do 20 or 30 or 40. That's certainly not necessary. And so here's just a little diagram that has to do with tissue healing. And so we can see here exercise-induced tissue healing takes about 0 to 3 days to feel like the muscles are fully healed from whatever exercise we've done. When we exercise and work on strengthening, the muscle fibers are actually getting tiny little bit of micro trauma to the tissues, to the fibers. They're coming apart a little bit. And that soreness that you feel is a sign that you've asked some work of your muscles. And so it takes a couple days for those fibers to kind of come back together and heal up stronger. That's where we get the benefit of doing it. So really giving yourself the time to listen to your body, listening to whatever soreness you might feel from doing any activity, and resting, because that really is just as important as the work itself. And then we're going to go into some stretches now. I know this is a guide on strengthening, but really strength and flexibility go hand in hand. What good is strength if you don't have the flexibility to use it? So this one is child's pose, which is a great one to kind of open up the back, open up the chest, even the hips. So as you can see, Sam here, she has her knees about mat's width apart, or a little bit outside of her shoulders. And you certainly don't have to go that far. Another way to modify it would be to bring your knees together, and that's going to give you even a little bit more stretch over the back. And so that should feel quite good. Nothing, intense or sharp or painful. If you're feeling that, please stop. That's a sign that it's too far. So that's a really good one.
Also on that, if you've got pain in your knees or ankles in that position, you can always put a little towel or a pillow between here and here under the ankles.
Yeah, definitely. And if you have trouble getting on and off the floor, this is something you could also do on your bed. Modify and adapt according to your ability. And so this is another way we can use our exercise ball. This is a great stretch, again, for the back, the chest. This one gets into also a little bit of a hamstring stretch, so those muscles at the back of your thigh, which I don't know about you, but my hamstrings are always tight. So this is a fantastic one for increasing mobility throughout your body and kind of just leaning in and relaxing whenever you feel like you need to. With stretching, it tends to take about 60 to 90 seconds holding that pose to really get the muscles to relax the way that they need to get the benefit out of the stretch. You know, it might edge into an area where it feels a little bit uncomfortable. That's generally a good sign that you're doing the stretch, you're feeling it. If it's sharp, that's not normal. We don't want that. You thought we were done. Another one with the ball. And so for this one, you can sit on the ball and then kind of walk your feet out and just open up and allow those arms to drape down, allow your back to extend over the ball. I've not run into too many people who have overly tight core muscles. That tends to be more weaker than tight. But this is a great stretch to kind of open up the chest, which does tend to be tight if we lean into this posture when we're working or doing anything. Okay. And another way to get even a little bit more specific with the shoulder on that stretch is to use a foam roller. And so with this, you would lay down with your spine lined up with the foam roller. Could be a little uncomfortable. If it's too uncomfortable for you, there's plenty of other ways to stretch that don't involve doing this, so don't feel like you have to. But this is a great one for getting all the different ranges of stretch throughout your shoulder. So you can bring your arm kind of in a snow angel, and wherever you're starting to feel a little bit like, oh, that's kind of tight, you can hang out there and allow that stretch to do its work in that position.
Yeah.
Yes.
If you don't have a foam roller and it's too big, take like a beach towel and roll it and then lay it with your spine along the
Yes.
of the towel.
Yes, definitely.
I fall asleep on the floor.
Yes, fantastic. There's tons of different ways you can do it without the foam roller. Someone in our audience, if you didn't hear it for our people online, they just said, you know, I use a towel rolled up beneath the spine, and that feels great. So plenty of different ways to go about this one.
So if you can only go so high, on your back, is your goal that over time you go higher? Is that something we want to try to do to expand the range of motion over time?
It's definitely something that you can find probably will improve as you're doing it over time if you're consistent with it. We don't necessarily need our arm, behind our head. If you're able to do things in your day-to-day life like reaching and dressing, and you're not finding that that's limiting you, you don't necessarily need to have, this extreme upper range of motion, but this stretch can be something that can help you work on that if it is a concern for you. And again, consistency would be key with that. So, making it a part of the routine will really help that come along. Okay. And then this is our last stretch. And so I'll have Sam demonstrate it with the feet actually on the ground and just kind of being open again in the chest, bringing the knees to one side, and allowing them to relax on the floor, and then back to neutral, and the other side. And so this is great for a muscle group called quadratus laborum in your low back. Kind of getting that nice little twist can help with stretching out that muscle, decreasing tightness there, where a lot of people tend to feel that tension in their low back. And again, if you want to make that even more of a core exercise, you can bring your knees to a 90-90 position and then bring them probably not all the way to the floor, but just bringing them about as far as you can, keeping that core engaged, and again, that'll get your obliques a little bit more.
And how long would you hold that for again? Like, is that 60 to 90 seconds?
Yeah, so when you're doing it as a stretch, bringing it down to the side, holding it for about 60 to 90 seconds there. And then whenever that time is up or you feel like you've gotten the stretch you need out of it, switching to the other side, holding for 60 to 90 seconds there as well.
As long as it doesn't hurt.
Yes, it should not hurt. Yeah, anything that's painful is your body talking to you and trying to tell you, maybe that's not quite right for us. Great questions. Okay. And then also a word about stretching. Some people tend to be on one end or the other of mobility. So being hypomobile would mean we don't move a lot. We're pretty solid, stable, maybe even tight. On the other end of that spectrum is hypermobility. So we're moving a lot. You might have laxity of your ligaments. There can be a lot of people who have dislocations or things like that. So if you tend to be on that side of the spectrum, always be cautious with stretching. And again, I would recommend seeking the specific care of a physical therapist to kind of guide you through what's going to be good for you. And so one way to kind of quickly test if you might be hypermobile, you can try taking your pinky down, and if it's bending more than about 90 degrees, that's a good sign that you're hypermobile. You can also take your thumb and try to bring it to your forearm. If your finger can touch your forearm, that's going to be hypermobile. If you can hyperextend your elbows, so more than straight, but actually out a little bit more, that's a point there. If you're able to touch your toes, bending down, no problem, that's some hypermobility as well. I cannot. Yes, and then for bringing your foot into that like 90 degrees of what's called dorsiflexion, bringing your toes up. If you can be 90 degrees or past so that your toes are more towards your ankle, like Sam, that's another point. So if you're, tallying up some points here, you might not need to go too crazy on the stretches. If anything, strengthening is going to be more important for you because we want to have stability to make up for the fact that we've got maybe a little ligamentous laxity. Okay. And then here is just the rest of the presentation is going to be more kind of generic information about posture, body mechanics, do's and don'ts types of things. So this is a stereotypical back brace. Some people might have that from their doctors, which is not bad. Having a brace can be really helpful for decreasing pain in the immediate present. However, the stability that it's giving you is kind of taking away from your muscles needing to do that job for you. So in the long term, it can kind of make you a little weaker and exacerbate the problem you might have had in the beginning that led you to feel like you needed the brace. So again, this is, I'm not saying good or bad, but just make sure you're using it under the guidance of either your primary care physician or a physical therapist.
Can I ask you a question?
Yes, please do.
I think it fits in with what we're talking about, stretches right now. And there are two different classes here at the core. One is the Iyengar type of yoga, and the other is more just a gentle yoga. And I started learning with one of your instructors just before the pandemic. I was here about a year before then. And she was just an excellent instructor. But I know with that form, you actually don't bend your knees when you're touching the ground. But with gentle yoga, they say you never want to keep it totally straight. So what does a physical therapist say?
So,
and also a yoga instructor, you're the perfect person that was a question that I had.
Yeah, so I'll take my crack at it, Sam, if you don't mind, and then please feel free to add. In my program, the running joke was always, it depends. We would feel so sick when we'd ask a question and my professor would be like, well, it depends. But unfortunately, that is what I'm going to say here. If your goal is to be stretching, if you're going down to the ground, you want to strengthen your hamstrings, trying to keep those legs straight is going to help with that stretch so long as it's not painful. However, if you're getting pain in your knees, in your back, in your hips, giving yourself a little bit of grace, having the knees bent is not a problem at all. So, Sam, what would you use?
But the point is I think what I'm hearing from you is it is okay
Yes.
to try to do that if your body, if it works for your body.
Yes.
So for me, that's okay, but somebody else, that might not.
Absolutely, yes.
Okay, well, that's because I wondered, am I hurting myself to try to do it, keep it straight?
No.
But it seemed more logical
Mhm.
to me.
Yeah.
No, and that's exactly right. If you don't have any predisposing tightness or pain, or if your knees don't hyperextend, if they don't go a little bit backward,
Mhm.
right?
And I do know the difference between the hyper.
Yes, exactly. I'm personally a big fan of a little tiny bit of bend in your knees, just because you're going to get a little bit more muscular engagement that way.
Okay, that's interesting. All right, thank you.
Yeah, absolutely. And so this is a diagram that emphasizes the importance of posture. So when we're standing with a nice, tall, neutral spine, that's going to be about 100% your body weight, gravity acting on you the way that it should, the way that your body is designed to carry that weight. If we're stooped forward, we're adding about 150%. And if we're carrying something heavy, it's 220%. And so, keeping a posture that is up tall, nice and neutral is really important. And then also if we're working at a desk and we're, hunched forward, that's where being mindful about these foundational movements really comes into play. So even when you're sitting at a desk with that, ideal position, your ergonomics lined up, that's still 140%. So we really want to be mindful of that. And then here's just a interesting little diagram of different postures that some people could have. And, for any number of reasons. It could be they have a scoliosis, and so their spine doesn't allow them to be in a certain position. Some people, if they've been in the military for a long time, they have a flat back and they stand with their feet so. And so this is really individual, but what we're going for, hopefully, is this good posture. No one has perfect posture. I don't have perfect posture. But this red line that we see through the side would be called a plumb line. And so we want kind of your ears over your shoulders, in line with your hips, your knees, your heels is ideal. And then, I don't know, Sam, if you want to step into the camera so they can see that as well. And I mean, only if you're really thinking about it can you have
it takes
perfect posture. But
a lot of work. And I will say for most Americans, we spend a lot of time looking at our phones on a computer, so our heads tend to be forward. It can take a little effort to move your head back where it's supposed to be.
yeah, I think a lot of us, myself included, if we're looking at phones, chin tends to come forward. That's a forward head posture. We like to have the chin kind of back in line where it should be. And again, if you have good core strength, that can make it easier to maintain that posture.
So is there a good posture to use while you're on your phone?
Have your phone high. If you can have it at face level, awesome.
Yeah.
I know that's not always an option. But yeah, I would suggest just staying off of it as much as possible.
Okay. And then here's just kind of a quick little photo to show what our desks, in an ideal world, if our desks could be set up like this, it would be great. So again, like Sam's saying, keeping the source that you're looking at your eye level, having your hands sort of out in front of you where they need to be, body kind of in that 90 degrees, a little bit of a support at the back, and then feet planted on the floor so that you can have some stability there. And when it comes to how to carry objects, yeah, we'll use the ball as an example. We'll pretend this ball is, very heavy. So we're not gonna bend forward and pick it up with our back. We're gonna bend from the knees and then keeping that object close to our body as we lift and push down through our legs. That is really good for preventing, an occurrence of a back problem. And then also trying not to bend and twist. So if we're kind of bending over and then standing as we twist, that can add some weird torque to our back and irritate it there as well. This is called a golfer's lift. So if you got something small like a dog toy on the rug you want to pick up, you can just kind of bend over. And this could almost be sort of an extension of what we talked about with our bird dogs, but bending forward at the hip, picking up that weight with our hand. And that's a good balance exercise too. And then last but not least, pushing and pulling objects. You could use the chair as an example, or the ball, either one. But the main thing is that we're gonna use our body to our advantage. We don't wanna be using our arms too much to do that work of pushing or pulling. We're really kind of putting our body into it with our push and our pull. And you can see here also with carrying the box, carrying it close to your body. And so you'll feel the difference between that, keeping it close to your body, using your body to your advantage, versus using your arms to do all the work. That's going to put much more strain on your back.
So your recommendation is to push or pull?
So with pushing or with pulling, either are fine, but when you're doing so, using your body to your advantage and not making your arms do all of the work of that, really using your body weight to move it. Yes. All right. And so then to kind of wrap things up, we always want to maintain good posture. Maintain good posture, maintain good ergonomics, so how we're set up at our desks, using our phones, things like that. How we carry or lift things, be mindful of that always. Taking one moment to be mindful and preventing an injury is so much better than ending up with pain and being on the behind trying to catch up. If you can incorporate back and core strengthening into your routines daily, or according to how your body is communicating with you, that is wonderful, again, to prevent issues. Listening to your body, modifying and resting is so important. I'm guessing the people that are here are probably the go-getters, the want to work, want to do everything they can, which is fantastic, and I love to see that. But being mindful that the rest is really just as important as the work. And then seeking professional guidance for any unique concerns that you might have. And that is what I have for you. Any questions?
Well, I have one more question. I like to walk run.
Yes.
And usually do about 4 miles.
Mm-hmm.
Maybe 5 days a week. Mm-hmm. And because of my age, which is really up there, is the running part not a good idea?
I hesitate to ever say that cardiovascular work is not a good idea. I would adapt it though, because running can be a lot of impact on your joints. And so listen to what your body is telling you. If you can run and you never feel like you have pain or difficulty with it, then by all means. I wouldn't say that that's something you should cut out of your routine. However, if you do notice that your joints are feeling achy, you feel like it takes longer to recover, that's something to maybe dial it back. Maybe not eliminate completely, but be more moderate about how much you're doing, and making sure you have good shoes, that you're on a nice even track, so there's no tripping, twisting ankles, things like that. Sam, do you have?
Yeah, she's absolutely right. I would just add to that running is actually an excellent thing to do for your core strength, because your core is being used the whole time. As long as it's not causing you pain, increasing your recovery time, awesome, go for
So I really liked it, but then you wonder, I'm 80.
Yeah, your
Is that bad?
body will typically let you know when it's time to stop running.
And then we had a question back there.
Yes, will you comment on why there was no exercises on bringing your knees to your chest in that position?
So, I mean, this is a general guide, and certainly if you feel like there's a benefit to bringing knees to chest and you can do that with good form, and that doesn't cause any back pain for you, then that's totally all right to do. The exercises that I selected for the purposes of this talk are just more gentle. Anyone can do them, easy to modify type of exercises. So that was my purpose for choosing what I selected. However, exercises where you bring knees to chest or where you bring your chest up off the floor are also great exercises for core.
I don't know if you were purposely avoiding that, because what's being said now is that if you have osteoporosis, not to do.
Mm-hmm.
Right, especially sit-ups and crunches, because you're bringing yourself into this rounded position. And something that happens with osteoporosis is called compression fractures. The front part of your spine will get squished a little bit, and those rounding movements can contribute to that sometimes.
So your slide about how much more load we take on our spine when we're sitting
Yeah.
is very revealing to me. So, when I was watching the Cats baseball, the regionals, I was sitting and hurting, so I opted to stand. I guess in our Eastern medicine, basically, the spine here, lumbar spine, and your cervical spine here, up to your cerebellum, is like the motor. It's like a pump. It needs to pump. And when you're sitting, it's like you're blocking the pump. And our stomach is sort of like our battery charger. So we need to charge our battery and then pump. So I find myself, I have to stand, but so many of us spend our time sitting, like we're sitting right now. My son sits 8 hours a day.
Right.
Either, video game, whatever.
Yeah.
So what do you recommend in terms of how often we need to get up out of our chair?
That's a fantastic question. So I honestly would say if you can get up and walk around every hour, and again, listen to your pain tolerance, your body, what feels right to you. If you feel like you need to move, please do, even now. But yeah, in my program, we would be when I was doing my didactic, my classes, 8 to 5, we're sitting in lecture. And our professors say how ironic it is that we're learning about movement and we're sitting here for all day. So there were tons of us who would stand while we took notes, or we would, pace a little bit just because, we should be moving about every hour. So does that answer your question?
Yeah, I think video games are passive.
Yeah.
Kids are sitting there for hours, not moving, and their focus is taken away, and they don't realize what they're doing with their body. And I think,
especially if they're gaming and they have this, I see a lot of young adults come into the clinic with this type of posture, and they got shoulder pain. They're young, and they're spending too much time in that position. Anybody else have any comments, questions, concerns? All right.
I appreciate your time.
Well, thank you so much. I am so thrilled to have such a great group to present to.
Thank you so much.